As of 2015, diabetes was the 7th leading cause of death in the United States. The long-term complications of diabetes are what make it such a devastating disease. Diabetes is the leading cause of adult blindness, end-stage renal disease, and non-traumatic lower limb amputation. Diabetes is a very treatable disease, however, and with proper management, those diagnosed can live long, healthy, and complication-free lives. Diabetes is a disease that's related to the use or production of insulin within the body, and there are two types. Type 1 diabetes is when the body doesn't produce insulin, and type 2 is when the body doesn't produce enough, or it's unable to utilize what it does have, or a combination of both. Type 1 diabetes is typically diagnosed in childhood, while type 2 may come on later in life. So insulin works like a car inside of the body, and its purpose is to transport sugar that we eat from our bloodstream into the blood cell where it can be used for energy. Without the proper amount of insulin, or when we can't use the insulin we have, that's when we see glucose readings go up. It is very important to manage your blood sugar and your diabetes because the long-term effects and even acute episodes of high blood sugar can have lasting effects on the body. Complications of diabetes occur due to damage to the blood vessels. When sugar is high, it destroys the tiny vessels called capillaries, leaving them unable to transport vital nutrients to our tissues and organs. The areas most affected by uncontrolled diabetes include our eyes, hands, feet, kidneys, and skin. This can lead to blindness, kidney failure with potential dialysis, painful sensations in our hands and feet, decreased wound healing, and even limb amputation. When blood sugar is controlled and diabetes is well managed, we can drastically decrease the chance of complications like these. With less sugar in our system, we see less damage to the blood vessels and more room for the movement of those vital organ nutrients. With increased blood flow to an area, we can improve our chances of successful wound healing and decrease the risk of infection. Long-term management of diabetes with routine monitoring of your hemoglobin A1C is also necessary to decrease the incidence of limb amputation. A hemoglobin A1C is a blood test that shows how well your glucose has been controlled over the last 3 months, and the goal for any diabetic is 7 or below. This promotes wound healing, helps decrease the chance of infection, and therefore works to prevent limb loss. If you have any questions about the management of your diabetes, please talk with your primary care provider about getting enrolled in a diabetes education course.